Yes.
All right, so today my presentation is about Cushing's disease in horses. It actually also occurs in humans and dogs quite frequently, but today I'm going to focus on horses because I love horses. It's also called equine pituitary pars intermedia dysfunction, also called PPID. So if you see equine PPID, it's just Cushing's for fun. All right. So what causes Cushing's? It's going to be a benign tumor that forms on the pituitary gland of the brain over time. So it occurs mostly in older horses, usually upwards of 25 years or so. But it actually sends signals all over the body. It affects hormone function. So a lot of ACTH, which is adrenocorticotropic hormone,
Good job.
is released. Thank you. Is released, and that actually signals the adrenal cortex in the kidneys to secrete excess cortisol, which is stress hormone. So the body reacts as if it's constantly under either slightly or excessively elevated levels of cortisol. So, yeah.
Now you said adrenal cortex, and that's not in the kidney, it's above the kidney.
It's above the kidney, correct.
Got it. Cranial pole of the kidney.
Yes, sorry, pardon me. Okay. So,
And look,
yeah.
the other thing I like what you said is, in horses older than 25 years, you know, it's like, man, I wish we had our dogs and cats that could live that long, you know,
Right.
pets. And then how long do you, I mean, because we're adding these little things now, what's the, I'm not sure world record, but what's the longest you guys have ever heard of a horse living? Give me some years.
I've seen a horse upwards of 42.
42.
I heard 36.
Yeah, and I'm going to say sometimes up to 40s, in the 40s. I'm not sure if the record is high 40s or like right. I mean, isn't that amazing? Huh?
51 is the record.
Thank you. Okay, what would we do? Was that a Google?
Yeah.
Thank you. 51. Think of it. 51 years. I remember, and this is a little add-on, but there was a story about this woman who grew up in Wisconsin and she had this horse. Then she got married and moved to New York or whatever, and she had to sell the horse. It was quite young. Then after her career, she moved back to Wisconsin, and one day she was driving. Who did she see in the pasture? The horse from her childhood, and she went and bought it.
Aww.
Can you imagine that?
That's like a
You know, can you imagine if the horse could talk, what it would say? Where have you been? You know? Take it away.
All right. So, yeah, that's basically the cause. And so, how do you know if your older horse has Cushing's? Laminitis, which is an inflammation in the hoof, which makes them go lame, so they'll start limping, they'll start looking sore and stiff. They'll either lose weight or gain weight, depending on what it is. So like the body shape, you can see that a little further down here. Their weight may all concentrate in really awkward adipose kind of areas, so they'll get like a pot belly down here, and they'll get really crusty up here, but the rest of them, you can see their hip bones as well. So their fat just really redeposits, and usually muscle wasting, you'll see that back here mostly. You'll start to see their hip bones and their shoulder bones most prominently. So they'll start to really stick out. Yeah. And they can also get ulcers in their mouth and excessive thirst, urination. Obviously, those two go hand in hand. It's basically like, yeah. So hirsutism, there we go, and abnormal shedding. Basically, your horse is going to be really fluffy, as seen by this guy here. It may appear cute, but it's not necessarily functional for, you know, the horse. So you can actually see it pretty well. Did I go back? Yeah, you can see it pretty well on this guy.
Yeah.
Pretty well on this guy here. He looks like he basically just hasn't shed it out yet. This guy's pretty fluffy too, but this one looks like he's starting to shed or hasn't quite shed out.
That one on the left kind of matches the model that you have in the next slide.
Mm-hmm. That was the thought.
Yeah.
Okay, and your horse is also going to be really prone to infection because their immune system is going to be more focused on dealing with cortisol and the other regulation of hormones that it feels like need to be regulated than like fighting off external infections. So, yeah. So diagnosing, like officially, should be done by a veterinarian always. Blood test for hormones is going to be your best. Like, this is your specific horse's case. This is what is being most affected by this disease, and this is definitely Cushing's disease. Cushing's is also often confused with equine metabolic disorder, and sometimes those two things they're fairly closely aligned, but Cushing's often has like the more fatty deposit and the weight loss kind of deal. Metabolic is similar in treatment and management though. So it's all fun.
Now maybe go back to that one because I just want to point out,
Yeah.
if people aren't familiar with this blood sampling technique, and I could, Monday, if you're unfamiliar with it, I could bring this whole setup here. What's kind of neat is you start with a tube that's evacuated. There's a vacuum in it. And then you have this needle holder, and then what's neat about this needle is that it's double-ended. You can see the part being put into the jugular vein, but on the other end, it's just like that, and it goes through this rubber stopper. And the trick is, when you're outside the animal, you never push this end of the needle into that rubber stopper, otherwise you lose your vacuum, and then it's useless. But then, because I use those things, many, many thousands. And what you do is you stick it into the vein, and like a horse and a cow, that jugular vein is huge, you'll never miss it. And then you have this end of the needle in, then you press the tube up through so the stopper goes through the other end of the needle. And then it draws in blood gently. And this looks like what's called a plain tube, so they're going to end up harvesting serum. But some, and different companies put different colors on, but sometimes if it's a green top, then that means it has heparin in it. But let me tell you a funny story here. They're very sharp, and you can order them inch long, inch and a half. Yeah.
We used those on sheep last week in one of my labs.
Yeah, oh yeah, and I've used tons of sheep. I could take blood sample from the tail of a big bull this way. But what's interesting is, one night, I remember I'm adding this on, I was taking blood sampling from sheep by myself. So I'm straddling them, and then, holding the neck and doing it without, because it's like 2 a.m. and it's cold out. And in human medicine, you would never reuse them to the next animal or next person. Did you guys reuse? Yeah.
The top.
Yeah, and how about the needle too, right? Did you go to?
No, we had different needles.
Okay. When you're taking a lot of blood samples, and like that tube is probably about 10 cc's. Anyway, we were reusing needles because they were all basically the same sheep, and I can't remember what we were looking for in the blood. But so I bled one sheep, and then I was going to cap it and then go catch another sheep and then reuse that whole thing, obviously a new tube. I was capping it, and it was dark, and I went like this. I went in one side of my finger, and it came out the other side. So I'm looking at it going, you know what, when I pull that out, there's going to be 2 spots that are bleeding. That side of the finger where it came out and this side where it went in. Like, okay. And then I still had sheep to bleed, so, But they're very sharp. The point is, it's incredibly sharp, and it went right through my finger, in and out, and I still had to work. I didn't, do anything. Leave. Go ahead.
I once did something similar when
Did
I was
you?
bringing ovaries.
Yeah, okay, yeah. You could do that.
Yep. All right. So that's fun. So managing, you have a horse with Cushing's now. There is no cure. It's it's just usually in horses at that age. It's on the brain. It's not really. There's nothing that really can. It's a benign tumor, so there's really no reason to chemotherapy it out, anything like that.
And you wouldn't probably with a horse anyway, unless
Right.
it was like an incredibly expensive racehorse.
Yes. Yeah, but it can be medicated. Pergolide is the #1 Cushing's medication. Usually just serves to regulate hormones that have been put out of balance. Bromocriptine also works, but it is less popular generally in America. I think it's more common in Canada. That's my thoughts. Yeah, so regular farrier visits, making sure your horse isn't going lame or isn't starting to show signs of lameness or signs of inflammation in the hoof. Get your horse hoof tested, get whatever shoes it needs, keep up on that regularly. Normal horses are 4 to 6 weeks. With Cushing's, I would like to recommend 3 weeks for a farrier visit, even though that's expensive. But yeah, so it's good
For the care of the horse.
for the care of the horse. I would like to see that. Limiting access to lush pasture, that'll just help them keep their weight a little bit more regular. Because if you throw a horse out on lush pasture, they're going to founder, they're going to have all sorts of other digestive issues, and we don't want that in addition to Cushing's, because that horse is going to have a lot harder time re-regulating its body after being thrown onto that lush pasture. Okay, so obviously going along with that, close diet monitoring. Making sure a horse is eating regularly, eating enough, and not eating too much. That is extremely important. Too much of the wrong kind of nutrients can make Cushing's, or can inflame Cushing's, and make it worse. Not the tumor itself, but it'll make the symptoms appear much more not effective, much more apparent. There we go. And it'll just cause your horse more stress, which is obviously not helpful when their cortisol levels are already way above normal. And make sure if your horse gets cut in the pasture, or if they, if they get a really, really nasty fly bite, which I've actually seen an infected fly bite before. It's not fun. Yeah, make sure you clean that really, really well and keep up with it and keep an eye on it, because the horse's body won't fight off infection like a normal horse. Any questions?
Okay, you're ready for questions. There's one. I'll let you point.
So on your previous slide, when you mentioned about like the change of the diet and how it can make the symptoms worse, is it just a matter of fixing that diet, or once the symptoms get worse, they stay there no matter what you do after that?
It depends on the horse, it depends on the case. It depends on how advanced the Cushing's is. So if those symptoms are already really there and they just get a little bit worse after throwing the horse on lush pasture or eating it too much protein or whatever, it could be just a matter of fixing it and managing it a little bit better, bringing it back. Consulting a veterinarian is never a bad option in that regard, but it honestly depends on the case.
Yeah, I mean, if you fed it wrong and there were certain more symptoms, I think it would come back to that baseline, whatever it was, if you remedied the bad factors.
Right. Generally the hope.
One of my horses actually has Cushing's, and he's been on Pergolide for probably about 5 years now.
Okay.
And it's the Pergolide, he gets one pill every day, and I think it's 130, maybe a little bit more, for 60 tablets, so that's every 2 months.
Okay. Now, do you just put it in the feed?
Yeah, it's really small.
Okay.
They're not huge.
Okay.
He just eats it with his feed.
Yeah,
He gets about a handful.
Do you verify that it's gone then? You know what I mean?
Yeah, it's like a pink pill, so you
Okay,
can
so
see
it's
it.
pretty
It's,
obvious.
smelling nice.
Because I think, I'm familiar with bromocriptine. Bromocriptine has interesting factors. If a woman doesn't want to lactate, a lot of times they give her bromocriptine. But do you know if the other drug, does that decrease the amount of ACTH secreted, or does it go to the adrenal gland?
Pergolide?
Yeah.
I'm not sure.
Okay, because that'd be interesting though, because the action could be on the pituitary to decrease the ACTH, or it could go to the adrenal gland and block the action of ACTH. I don't know.
Online it just says it controls the clinical signs.
Yeah. That won't get. That's what I'm talking about, is the mechanism. I want to know where it goes and what does it do when it gets there. Anyway.
She actually kind of answered that. I was just going to ask, after you give them the medicine, do the pot belly and the long hair go away?
No.
No?
No.
Okay.
Well, my horse has pretty good body condition with him. He has excess urination and the long hair, so I completely shave his body a couple times a year, because even in the summer he'll just grow hair. That's
Now, how old is he?
He is 23. He actually got diagnosed fairly young for a horse.
Okay.
So.
How many years ago? I'm just trying to. Was it in the 20s?
5-ish.
Huh? Okay,
5-ish.
so late teens. Okay, other questions, comments? That's neat. Here's one over here. Oh.
It just says it works by taking over regulation of the pituitary gland, helping to decrease ACTH.
Okay, so
and lower blood cortisol.
yeah. Okay, so I think what both of those drugs do is they target the pituitary gland and decrease the secretion of ACTH, and therefore then you get less cortisol, because ATH goes to the adrenal gland and tells the cortex to make more cortisol. So it'd be what's really neat about that, and maybe somebody could look up the blood work, because I used to give ACTH to overectomized heifers, and so then what I would do is, that way if they're overectomized, nothing's coming from the ovary, and we would look at how many steroids were put out by the adrenal cortex, like progesterone. So my guessing is, not only do they have higher cortisol, and we could look this up someplace, but I bet you they might have higher levels of some of the other steroids as well. I don't know for sure, but when you give an animal ACTH exogenously, all the steroids go up from the adrenal cortex. So very interesting.
So if it's like a stress, like healing, or the body thinks it's under stress, do they, like the first couple years if they're, or the first year that they get it, are they like physically like stressed out and then they just kind of like learn to live with that, or?
I don't know. I actually don't know like psychological effects that might appear, but I think it may just be physical response.
Did it have any behavior
Yeah.
changes when it became?
Not really.
Does
He's
he-
got pretty
Yeah.
sensitive feet, so he's got like wet shoes on, which
Okay.
is just to help with like laminitis and
Right.
stuff. But yeah, like personality-wise, he's still the same. He's retired now. I don't really show him anymore. or anything.
Okay, yeah. See, now cortisol is supposedly the stress hormone. When animals or people get stressed, that goes up. And actually, in people, they've done experiments where there's so much cortisol, you can spit in a test tube and there's cortisol in your saliva. It spills over that way. But so maybe there wouldn't be any psychological effect. It's just more of the physical and hormonal internal stuff. Good questions, though.